emergency situation in emergency hospital. Звук включен, да, Жень? Okay. It was coiled in emergency hospital with balloon assistant, and patient came for the second session for the MC aneurysms, but during the control angiography we found one more aneurysm in pericallosal artery on the left side, and now we little bit change our strategy for today, and we'll go for the left AC aneurysm with the septal balloon assisted coiling, and I think we need to place the stent, and stent would be, it could be Elvis Evo in this situation. We'll place one small coil, and we'll place Elvis Evo stent. The guiding is 8 French Asahi Hyperion. It's a coronary guiding. We put 2 Y connectors, one with the connecting tube, and the second one just a Y connector with a click. Okay, for the septal balloon I will take Traxxas guide wire, Traxxas 14, and for the headway microcatheter, headway 17, I will take Chikai Black, because it's usually easy to navigate into the aneurysm with the Chikai Black. It's our usual practice, but sometimes we change the strategy. We can change the wires between the microcatheters, and we can see during the operation. Так, контрастно кuyasаңыздар. In between I will talk in Kazakh with Bakhat, our nurse, and with Devlet, my colleague, neurosurgeon, and my assistant for case for today. Altruist. Rahmet. Rahmet in English means thank you. And thank you very much is Ulken Rahmet. The direct translation would be big thank you. Женя, у меня петличка чуть-чуть натягивается. Now I'm speaking in Russian with Evgeny. He's our colleague from the TV. Женя, петличка чуть натягивается. Да, отлично. Чуть назад. Сальса артха. Бол. Да, если можно, да. Спасибо. Это вот проводник. Мы его так загнули. 2 изгиба. Это у нас Headway 17. Мы его загнули под примерно 45 градусов, да. Не, нормально. Может быть, немотоп? Норма? Nematop var mı?
Nematop и yeah.
Жоқ, 15 емес, 30. 30 means 30. We have a flashing system with a 2-liter saline. Usually it's 15 milliliter of nimodipine inside the 1 liter. But in this case, we will use Autoversal. Okay, it's a gravity system. I'll take it. Yes, we are using for 3.5 years now the zero gravity. It's very useful, and it prevents the back pain and the damage of meniscus. I had some problem with my meniscus, but nowadays no problem. Okay. Remote қазір. This is a scepter with access and headway with the Chikai black. Қазір. Yes, and it's very easy. Женя, можно будет один перерыв сделать то, что мы писали, и сейчас я скажу. Здесь еще раз надо будет. Okay. Now we can see the 3D on the left side. There is one aneurysm coiled before and the second aneurysm here. Because of the flow, we couldn't see clearly. It's a de novo aneurysm. We couldn't see last time, and now I think it's a de novo here. And this was the ruptured one. And diameter of the ICA it's nearly 1.9 millimeter distally and 2.1 millimeter proximally. We have two options. We have Leo Baby 2x18 and Elvis Evo 2.5 and 12. I think we can use short Elvis Evo. It's very useful. I have a mouse and I can scroll. I can then I can do like this. Okay. I think it's better here. Okay. I can do measurement. Yes, and I can do it with the mouse. In the operating room, it's very useful. That's why when we choose the angiography system, it was the first criteria when we choose the angiography machine. It's very easy to use, and okay, the flashing is working. Now I will do a run. Yes, and access inside the choroidal artery. It's okay. Just a second. Pause. Per second. Yes, I will do like this. Yes, there is no problem. And usually wires try to go to the unintended direction. Also. Okay. Also means this one. Okay, first of all I will try to navigate my scepter. the importance of using the biplane system. It's very helpful, and need to take it a little bit back. Okay, it's a success. On AP, it's okay. On lateral, we didn't see the distal tip, but on AP projection, we see the distal part of the tip of the wire. It's very important to see all the time the tip of the wire, because it's potential danger of this navigation. The distal tip. It's first. The second is would be the Chikai black. And after placing the micro catheter, we completely changed the anatomy, and it's not the same anatomy as on the road map. Usually it's a little bit different. And then I need to change my road map also. Okay, the wire is trying to go inside the aneurysm. It's not inside. Yes, and easiest option could be the flow diverter treatment of these aneurysms. Okay. But it's all the time some concern about the side branch on bifurcation. Zoom. Yeah, there is. Максимально. Maximum physical zoom. Okay, now I'm inside the aneurysm. Okay. It's a 1 millimeter aneurysm, and usually it's a little bit problematic to navigate. My micro is not going inside. Okay. Now I think I'm inside the aneurysm. Probably. Yes, inside. Bir жарымда екі или бір жарымда үш болады. Okay. Then I need to compress with my balloon micro. Bir жарымда екі бере салайын. Yes, we decided to take 1.5 by 2 millimeter coil. Разница же. There is two choices. Microplex or Optima. Optima bir жерінде екі. And the bulb changed the tube for the Optima, and now it's very soft. Before it was like in Microplex coils, but now it's a little bit soft one. Okay, it's here. Push. My balloon is deflated. Sometimes it happens, and now I will inflate again. So 2 markers on headway. The first marker and the second marker inside the aneurysm. And there is some pressure on the coil, and I will take a little bit back the microcatheter. Okay, I will a little bit deflate the balloon. I will try to push my micro. Okay. Yes, it's not all the time easy. Okay, I need to replace my microcatheter. Сейчас also. It's just a 1.5 millimeter aneurysm, and we have some kink in IC below an extracranial. That's why my microcatheter is doing not one-to-one movement. The balloon is deflating all the time. Okay. I will deflate completely. Давай engage surgic. I will repeat the DSA. Okay. Stop. Smooth mask. It's very useful to use smart mask option, and then the roadmap is more sharp and more precise. And catheter is touching the posterior wall of the aneurysm. That's why we have this kind of problem. I'm not sure I can rotate the micro. As the pusher of the coil is a little bit deformed, and I have enough space. Now I can inflate my balloon. Then I can place the coil. Yes. Три przewody. Yes, there is no space inside the aneurysm. No, it's okay. It's look like okay. Yes. Yes, because of recanalization, if everything is clear, I will place the stent. But before the stent, DSA. And then we will do expert CT, and after we will decide about the stent. Okay. Okay, I inflated my balloon and now I detached the Ultima. Aldım kıtırı ses olunca. Yes, I hope everything is okay. Baby rooms var elde ava rooms var. Baby rooms var. Okay. İlk D16 birisi. Покаж Petrator. I took out the headway 17. My balloon is inside the artery. I will take out the success from the balloon. And now we can do this city.
City.
Yes. Control DSA. And this patient has two aneurysms on the right MCA. Just a second. Diagram, patients. The both aneurysms are wide neck. This is a MC aneurysm. I will put like this. M1 segment aneurysm on the temporal branch, and the bifurcation aneurysm on the MC bifurcation. Maybe we need to treat both aneurysms today, or we can stage them. Birden isteyimiz var, bölümümüzü.
Oh.
Birden isteyimiz var, bölümümüzü.
Oyuncu mu? Там же
Okay.
сейчас левый будет стоять, потом на следующий.
Okay, this is the beauty of smart flex vision. In most of the systems in Kazakhstan, it's not available. Okay, I think only in our system it's possible to enlarge and to see the all images. Because okay, we'll control the CT if everything's okay. Then we'll place the stent. The stent would be 2x18 little baby. Там вторую нарезку можно будет тоже остановить и третью нарезку сделать. Жоқ, керек. Общий аласың. Уақытын жазып отыр. Наталья, такое ощущение, что камера стоит слишком направо. Да. Можно чуть-чуть ближе к центру.
Ближе к центру.
Да,
Хорошо.
чуть-чуть, слегка.
Можно камеру поправить, сейчас же не подойдет.
Да, ничего. Можно уже на вторую операцию. Или даже к концу этой операции. Ну, вроде разрешение очень высокое.
Подожди.
Подожди, да? А есть большего разрешения?
Да, 4К.
4К. Все. Okay, CT is ready. Екінші трубканы тартып бер. Okay. The beauty of the system, all measurement, manipulation on the angiography. It's possible on the inside the operating room. Yes. The patient has some gliosis. I think it's after the first subarachnoid hemorrhage. Stent.
Проекция проверения.
Идет прямой боковой ВСА. О. Жоқ нені бересаш? Baby. Yes, we decided to place the little baby finally. There is It's one more option. It's possible to do 3D roadmap. This is 3D from left side, and it's possible to do it's not possible in reconstruction 2, but in reconstruction 1 3D roadmap is active, and now we can place it like this. Okay. Use it. Okay. I will place it like this. And from the Monday we have now the cartridges for the very final system, and now we will do Kazakh tromba test. Patient on Brilinte, huh? On Triventin, it's a ticagrelor, and it's a generic of the Brilinte. It's produced in Almaty city. Yes, but the effectiveness is nearly similar like Brilinte. But in Kazakh population we have less than 5%, but resistance, less than 5% resistance. It's not 100% effective drug. But the resistance is 3 times lower than in clopidogrel. Okay, the lid is pushed. Okay, now you can see full screen, and you have subtracted and unsubtracted view. Thanks to Philips company, they brought the TV TV module, and then we can see all this big screen inside the physician's room, inside department. It's very useful for the teaching purpose and for the control, and I can take some coffee and sit in the physician's room and can enjoy the operation. Okay, I think we can little bit pull. The lid put at the timer. Okay, this is a point we still can resheet the stent, and after this we'll do first control angiography. Everything is okay or not. Everything is okay. And now we will wait 7 minutes. After 7 minutes we will do the second run, and on 15th minute we will do the third control run, and if stent is clear we will finish the case. Okay. The beauty of this system, we can do like this. And we can see on big screen, we can measure. It's very easy. We can enlarge, we can take this, do like this. 2 mm. Sometimes measurement is can have a little bit difference, less than 5%. Now it's okay, and the length of the stent now it will finish like this. Would be like this, but my stent is 2x18. Yes, and I asked. This is on 3D roadmap, how it's look like. Yes, it's usually after placing the micro instrument, the vessels are a little bit changing in anatomy, and it's not all the time 100% exact anatomy. Histogram. To take this image with some remnant neck, I asked my colleague Davlet to do 2 runs. It was one was clear run like this, and after doing this second 3D with contrast, we can nicely see the aneurysm without coils. I think this the same option available on Siemens, and this is CT. Yes, we can see everything inside the operating room. It's the beauty of the system. With the Siemens it's also possible, but you need the technician in the in second room. Okay. With the mouse it's easy. Yeah. It's not a joystick like in Siemens. With mouse it's very easy. As everything is clear. There's some gliosis after the first subarachnoid hemorrhage. Now it's okay. Again we can put the previous 3D, and we can do the 3D roadmap. Okay. Заканчиваем тут 30 minutes. Now 4 minutes left. Okay. Мындай камера болот болсо ана жерге подставка керек экен го, да? Стенага. Но гипсокартон го. Но гипсокартон. Забивает угольник. Угу. Dolby система ма, звуковой. Проектор. Yes, and it's very useful to use this system. I have magnet on the Gillette, and the second, I think it's metal, and this is magnet, and I can adjust on the height of the physician, and it's one-time cover. It's sterile. There is protection glass, and it's nearly 25 kilos. It's very useful. I can do like this. 6 minutes. Жүже қарауытым. Ол. 3 Now 6.5 minutes. You can see the timer on the left side at the bottom. It was 6.5 minutes. Okay, the second control. The stent is clear. Yes, we have a paper together with the Kublai Aydın and the Istanbul team, and we did the drop on stent monotherapy, and we tried to show that if we place one braided stent in distal anatomy, effectiveness in mid-term it's nearly 60%. If it's necessary, we can place the second stent inside, and the effectiveness increases up to 80%. And this kind of procedure could be staged, and it's I think it's very useful in the countries with middle and low income, and we can split the treatment sessions for 2 or 3 sessions, and economically it would be more useful for the hospital, for the patient, and it's less thrombotic when you place second stent after 6 months or 1 year. If you place both stents at the same session, it could be a little bit thrombogenic. Okay, 2 minutes left. Now we need another 6 minutes. Okay, let's wait. 8-ге жеткеніңізді бір аңге жасап қоя салсын да. 8-9-ға жеткеніңізді. Микрофон істеп тұр. Қағаз керек. Қағаз. Yes, when you have no verify now or multiplate test, the Kazakh thrombotest is very useful, and we try to decrease our stent thrombosis rate for the less than 3%. And in European countries, the resistance for the clopidogrel is nearly 6%. Yes, we decreased twice. But unfortunately, in our country, we have no antagonist. That's why we need to do Kazakh thrombotest. It's waiting time. Қазақ тромботесті өтеміз. Қазақ тромботесті өтеміз. 15 күтеміз. Ана тест жоқ қой. Не, Берлин ташып жатыр, бірақ көмектеспейді ме соны анықтау керек. Тридер родма. We have a webinar with the work. Presents some possibility. Yeah.
Сигнал плохо идет.
А, там звук туда привязан, да? Окей. Okay. Together with Jay Petro, today we'll start geographic systems. This one. The next case we plan to do on geography, it would be just diagnostic and was a control DSA for the left subclavian stent. Was placed 1 year ago, and we found some intima hyperplasia, 60%. We decided to not touch. And this is aneurysm case second, and third would be DSA, and case number 4 would be cavernous the meningioma. Thursday, operative embolization. Aneurysm. Сейчас я зайду.
Нестабильно.
Здесь, да, может приемник там, а там внутри хорошо.
А, Жень, надо будет камеру чуть-чуть сантиметров на 15 сюда подтянуть, да? Можно будет сейчас подтянуть, чтобы мы... Ну, вот так мы... Yes. We'll a little bit move the camera and then we will do control. I think it's better. Да, вот так хорошо, Жень. Now it's better. Джасевер, Далит. Входите сейчас. Да, вроде получше. Просто вот этот манжет, она поле закрывает. А, халдырсыз. Okay, Kazakh thrombotest is negative, stent is clear, and now we can detach the stent and finish the case. Okay. You can see on 3D, you can see unsubtracted, you can see subtracted. Now stand is detached. It's possible to go with the balloon, but I don't think it's necessary. Okay, let's try. It's possible to go inside the stand with balloon to be sure that stand is fully opened. It's a stand angioplasty, stentoplasty, and now it's okay. Чашка вырастешь? Okay, after all cases we are doing the hijama. Hijama, we need to take some piece of blood because some thrombus could be around the micro. Yes, it's a recommendation from Shimon Maimon, from my teacher. He's from Tel Aviv. Okay, in working projection. And then in AP and we'll finish. Yes, then I will take my guiding a little bit back on the common carotid. Держи. Check again. Everything is clear. And now David will do the DSA from vertebral, позвоночник, и контрольный КТ. He will do the... Меньше, вкати. Okay, thank you. Kaz, КТ жасайды. System looks clear.
Так, тут звук.
Звук есть, да? Ага. Yes, it's look clear. No aneurysm. I think it's enough. Now we'll do Control CT and finish the procedure if everything is clear. Yes, it's very useful. You can do CT and 3D on the table, and it saves time. В итоге так решилось, да? Это телевизионный кабель же, да?
Да. Получается, туда не подожди. Сюда приходит и уже через компьютер туда.
Now we can see the Control CT. It's also on the full screen. It's clear. Ventricles clear. Stent is okay. Yes. Thank you. We will finish this case, and in another 30 minutes we will start the next patient. Okay, thank you. Можем заканчивать, Жень. Можно закрывать.